can be started by clenching or grinding the teeth. A bad bite caused by missing teeth or badly aligned teeth, a blow to the joint, arthritis, or emotional stress. Clenching and grinding will often go away once a person's stress is reduced, breaking the cycle of TMJ syndrome. In the meantime, there are other ways to break this cycle. You can reduce muscle spasms and pain with moist heat, inflammation-reducing drugs and muscle relaxants, muscle massage, and a soft diet. To restore balance to the joint, we may crown teeth, fill spaces, adjust the bite, or even move teeth. A splint, which is a plastic mouthpiece, can reduce clenching and grinding and help restore harmony to the joint. In extremely severe cases, surgery may be necessary to repair the damaged part of the joint. Millions of people suffer from TMJ syndrome. Treatment and lifestyle changes can break the TMJ cycle and restore harmony to the joint. The reason for using nitrous oxide, or laughing gas, is for its calming effect. Since it doesn't numb the teeth, anesthetic is still necessary. It just has the nice effect of making a person more relaxed. You breathe nitrous oxide in through a small mask that covers your nose. It takes just a few minutes for you to notice the effects. People most often describe the feeling as being relaxed, unconcerned, happy, slightly numb, and disconnected from what's happening around them. We can adjust the dosage of the nitrous oxide gas to fit your needs. You can also control its effects by your breathing. The more you breathe deeply through your nose, the more you'll feel its effects. There are no long-lasting effects, and you can safely drive after a dental appointment. We won't use nitrous oxide if you're pregnant, have an inner ear infection, or asthma. Let us know if you'd like to try nitrous oxide to feel more relaxed during your next dental appointment. In our office, we take pride in adhering to the highest possible infection control standards. We scrub our hands before and after each appointment, and always put on a new pair of disposable gloves. We wear masks and protective eyewear. All instruments are sterilized with an autoclave. Our handpieces are always heat sterilized between patients. We use disposable supplies. We use protective barriers on exposed surfaces and disinfect all other surfaces according to government standards. We dispose of biodental waste and sharp instruments in safe containers provided through a biomedical disposal company. All staff members are vaccinated for hepatitis B. We regularly update infection control procedures for all staff members. We adhere to these infection control procedures because your health and welfare are important to us. The diagnosis of periodontal disease and cavities are two important parts of a dental examination. Since you may have periodontal disease yet have none of the symptoms, we perform a thorough examination using X-rays and a periodontal probe to measure bone levels around the teeth. When the bone level falls, the gums pull away from the tooth, forming a pocket. We measure the depth of this pocket with a periodontal probe. The measurement is from the bottom of the pocket, where the gum is attached to the tooth, to the top of the gums. These are healthy gums. They're tight against the teeth, and there aren't any pockets. Now notice the difference with early periodontal disease. In general, the deeper the pockets, the greater the spread of periodontal disease. Bleeding is a sign of infection. Healthy gums don't bleed. We also examine the color and shape of the gums. Notice the pink color and the lightly stippled appearance of the healthy gums, like the surface of an orange. In this case of moderate periodontal disease, we see the red and swollen infection of the gums. The stippling disappeared when the gums became swollen. Look especially close at the difference of the gums between the teeth. This is where periodontal disease usually starts. X-rays tell us a lot about periodontal disease. This is a healthy mouth. The bone comes up high around the necks of the teeth, and it's even throughout the mouth. This is advanced periodontal disease. The bone level is much lower. Notice how uneven the bone levels are compared with the healthy mouth. So now you know how we diagnose periodontal disease. Probe readings greater than 3 millimeters, bleeding upon probing, swollen and red gums, especially between the teeth, and bone loss or tartar on the X-rays. You also know what caused periodontal disease, the accumulation of plaque. The bacteria in plaque also produces acid. This acid destroys the enamel of your teeth and gives you cavities. Finding cavities is sometimes easy, but sometimes it's not. For hard-to-find cavities, we use a dental explorer and x-rays. We check the tops and sides of your teeth with a dental explorer. To look for cavities between teeth, we use x-rays. Metal fillings and crowns show up as bright white. Cavities show up as dark spots. These small dark spots on this x-ray are cavities. It's far better to catch and restore cavities while they're still small and in the enamel layer of the tooth. Once they're in the softer dentin layer, they really grow quickly. If they make it to the pulp chamber, we have a whole new set of problems and a different problem to discuss: root canals. The dental profession has assigned each tooth a number and every surface of a tooth a letter. If we find cavities in your teeth, you'll hear us name the numbers and letters for each one. Of course, what we all hope is that you keep all the plaque off of your teeth, so you'll never need to know about these numbers and letters. Once the pulp of a tooth has become infected, your choices are limited. You could choose to delay treatment, you could choose to have the tooth extracted, or you could choose to save your tooth with root canal treatment. The problem with delaying treatment is that an infected tooth will never heal on its own, and this can lead to some very serious problems. As the infection spreads down the tooth and into your jawbone, the pain may become excruciating. It could even put you in the hospital and threaten your life. An extraction is only a short-term solution. While it does remove the source of infection, it sets off a chain reaction of shifting teeth and other dental problems. The only way to save your tooth and keep it in your mouth is to remove the infection with root canal treatment. An apicoectomy is a minor surgical procedure, necessary when root canal treatment hasn't completely healed an infected tooth. After root canal treatment, an abscess, which is a hole in the bone at the tip of the root, sometimes continues to grow. To stop the infection, we make a small incision in the gums. We remove the infection and then seal the tip of the root. Once this has been done, the infection will heal, new bone will grow in, and the tooth will be healthy again. When the nerve of a tooth becomes infected, root canal treatment can save the tooth. You may realize you have an infected tooth because it's sensitive to hot or cold, it causes swelling and pain, or it gives you a bad taste in your mouth. You may also be completely unaware that you have an infected tooth because you experience no symptoms at all. The white outside of a tooth that you're used to seeing is the enamel. Inside the enamel is another hard layer, the dentin. There's a small chamber at the center of the dentin called the pulp chamber. The tooth pulp is a soft tissue made up of nerves, arteries, and veins. The pulp extends from the pulp chamber down through a narrow channel, which is the root canal, all the way to the tip of the root. In general, teeth in the front of the mouth have only one root canal, while teeth in the back of the mouth have 2, 3, or 4 root canals. How do teeth become infected? Deep cavities can allow germs to get into the pulp chamber. These germs cause infection, and the pulp dies. The pus from the infection eventually builds up at the root tip and makes a hole in the bone. This is called an abscess. This cavity entered the pulp chamber here and caused this abscess, which is the dark area at the tip of the root. A blow to a tooth may also cause the pulp to die and then become infected. An infected tooth will never heal on its own, and as it gets worse, it will continue to be a source of infection that drags down your immune system, and that can affect your entire body. This damage to the bone and the swelling inside the bone can be excruciatingly painful and even life-threatening. Years ago, an infected tooth would just have to be extracted. But today, we can save your tooth with root canal treatment. Root canal treatment and restoring the tooth usually involves 3 steps. First, we remove the infection to promote healing. Next, we place a post to strengthen the tooth, and then we crown the tooth to protect it. We want the entire procedure to be comfortable for you, so the first thing we do is make sure you're thoroughly numb. We place a rubber dam around your tooth to isolate it from the rest of your mouth. It protects you like a safety net. Nothing can fall to the back of your throat. It also keeps the tooth dry and accessible so we can do a better job. To get at the infection, we make an opening through the top of the tooth down into the pulp chamber. This is a dental file. We use it to carefully clean out the infected tissue and shape the canals to receive the filling material. We take x-rays to make sure that all of the infected pulp is removed. Sometimes it's necessary to strengthen a tooth with a post. The post reinforces the tooth. It's cemented down inside one of the root canals. Making a crown is the last step in restoring your tooth. It protects your tooth and gives you back your smile. There are many types of dental work that might be an alternative to orthodontic treatment. Crowns, bridges, bonding, and implants could be possibilities. Leaving teeth as they are is always an option. You will need to consider the choices presented to you to decide what treatment is best in your individual case. Malocclusion is the dental term for teeth that don't fit together properly. Orthodontics is the branch of dentistry that corrects malocclusions. The size of teeth and how they fit into a person's jaw are inherited traits. Some people are lucky and naturally have straight teeth. Others aren't so lucky. Habits such as thumb sucking can also put pressure on teeth and cause a malocclusion. Missing teeth can cause a bad bite to develop. The teeth around a space will shift, and this can throw off the entire bite. There are many types of malocclusions. The upper jaw may be too far out. The lower jaw may be too far out. Both jaws may protrude. Crowding may be a problem. There may be too much space between the teeth, or teeth may be in a crossbite. A malocclusion that isn't corrected can really affect a person's profile and appearance. It may also contribute to tooth decay, bone destruction, loss of teeth, and jaw joint problems causing headaches, difficulty in opening and closing, clicking and popping, and sore and painful jaw muscles. Correcting your bite through orthodontic treatment can improve your dental health. The added bonus, a boost in your self-confidence and a terrific-looking smile. Teeth can be straightened at any age. In fact, 1 out of 4 orthodontic cases in the U.S. today is on adults. Until the 1980s, a steel band went around each individual tooth like a ring. The wire that pulled the teeth into line was attached to a little bracket that was on the front of the steel bands. You may remember what this looked like, a mouthful of metal. Fortunately, today, we've replaced these bands with brackets that are bonded with an adhesive right to the front of the teeth. They're much more comfortable, smaller in size than an unpopped popcorn kernel, and much less noticeable. Clear sapphire brackets are also available, but they're usually more expensive and tougher to keep clean. A stainless steel wire still connects the brackets, and different sizes provide the pressure to move the teeth. Elastics that now come in many fashionable colors hold the wire in place. Special elastic bands may be added to speed up teeth movement. Different wires and attachments are used in difficult cases. In this case, we're bringing an eye tooth down into place. It's pretty amazing how far teeth can move through bone. Your bone responds to the tension created by these brackets and wires by making special cells on each side of the tooth. These cells remove bone on one side of the tooth and make bone on the opposite side. That's what allows the tooth to move. It's harder to clean your teeth once braces are on, so regular cleaning appointments are more important than ever. Permanent white stains may form on teeth if plaque isn't regularly removed. After treatment, retainers are used to hold the teeth in their new alignment. Some retainers are designed to be removable, while others are cemented in place. It's nice to know that through orthodontic treatment, you're never too old to improve the health of your mouth and have a beautiful smile. Until recently, orthodontics was used mainly to straighten crooked teeth. Now, when problems are caught early enough, it's possible to actually alter the facial development of a growing child by using functional appliances. Other orthodontic appliances don't work with facial development, but do move teeth and correct malocclusions. This appliance corrected the bite of these back teeth. This one corrected the bite of the front teeth. A third kind of appliance, called space maintainers, are used after a baby tooth has been lost. They maintain the alignment of the permanent teeth. This one is keeping the molar from shifting forward. This one is stabilizing teeth on both sides of the mouth. Braces are used to correct a bad bite once most of the permanent teeth are in. Until the 1980s, a steel band went around each individual tooth like a ring. The wire that pulled the teeth into line was attached to a little bracket that was on the front of the steel bands. You may remember what this looked like, a mouthful of metal. Fortunately, today, we've replaced these bands with brackets that are bonded with an adhesive right to the front of the teeth. They're much more comfortable, smaller in size than an unpopped popcorn kernel, and much less noticeable. Clear sapphire brackets are also available, but they're usually more expensive and tougher to keep clean. A stainless steel wire still connects the brackets, and different sizes provide the pressure to move the teeth. Elastics that now come in many fashionable colors hold the wire in place. Special elastic bands may be added to speed up teeth movement. Different wires and attachments are used in difficult cases. In this case, we're bringing an eye tooth down into place. It's pretty amazing how far teeth can move through bone. Your bone responds to the tension created by these brackets and wires by making special cells on each side of the tooth. These cells remove bone on one side of the tooth and make bone on the opposite side. That's what allows the tooth to move. The time a child spends in braces depends on the severity of the malocclusions, but it's usually between 1 and 3 years. It's hard for children to clean their teeth once braces are on, so regular cleaning appointments are more important than ever. Permanent white stains may form on teeth if plaque isn't regularly removed. After treatment, retainers are used to hold the teeth in their new alignment. Some retainers are designed to be removable, while others are cemented in place. Successful orthodontic treatment is a partnership of effort of everyone involved. Through a cooperative effort, the final goal can be reached: a healthy mouth and beautiful smile. Bite wing X-rays are the most common X-rays taken in dentistry. We use them to find cavities between the teeth, see tartar on the roots, worn-out fillings, and receding bone levels from periodontal disease. A small packet of X-ray film is placed inside your mouth, and by biting on the tab on the side of the packet, the film is properly lined up to get a picture of your upper and lower teeth at the same time. The lead apron protects the rest of your body while we take X-rays of your mouth. Dental X-rays use high-speed film, so the amount of radiation exposure is very low. Though machines vary, bite wing X-rays only add as much radiation as you'd get from about 3 extra weeks of natural background radiation. Even if you've recently had X-rays taken of other parts of your body, bite wing X-rays do not add to that exposure. Bite wing X-rays are a necessary part of regular dental checkups. They give us vital information that we can't get from any other source. A full mouth series of X-rays is the first step in a thorough dental examination. We take this series of X-rays so we can find cavities between the teeth, worn-out fillings and crowns, tartar on the roots, and receding bone levels and abscesses. We place 18 separate film packets in specific locations to thoroughly evaluate your entire mouth. The lead apron protects the rest of your body while we take X-rays of your mouth. Dental X-rays use high-speed film, so the amount of radiation exposure is very low. Machines vary, but a full series of X-rays only adds as much radiation as you'd get from about 8 extra weeks of natural background radiation. Even if you've recently had X-rays taken of other parts of your body, a full mouth set of X-rays does not add to that exposure. A full mouth set of X-rays is an important part of a thorough dental examination. It gives us vital information that we can't get from any other source. A panographic X-ray gives us a panoramic view of your mouth. It gives us valuable information about the position of wisdom teeth, receding bone levels, which is a sign of periodontal disease, abscesses, jaw joint problems, and sinus problems. The X-ray film is positioned outside your mouth, and the X-ray head rotates around you. The lead apron protects the rest of your body while we take X-rays of your mouth. Dental X-rays use high-speed film, so the amount of radiation exposure is very low. Though machines vary, A panographic X-ray only adds about as much radiation as you'd get from 10 extra days of natural background radiation. Even if you've recently had X-rays taken of other parts of your body, a panographic X-ray does not add to that exposure. Panographic X-rays are comfortable and safe. They give us information that we can't get from any other source. If you have periodontal disease, your choices are limited. You may choose treatment or to delay treatment. Treatment involves a combination of root planing, new home care techniques, more frequent dental cleanings, and in severe cases, surgery. Delaying treatment will never make periodontal disease go away. Periodontal disease is an ongoing degenerative disease. Bone lost never grows back. If too much bone is lost, teeth get loose and have to be removed. This means you may end up wearing partial dentures or even full dentures. You don't have to lose your teeth to periodontal disease. Treatment removes the infection and keeps the disease under control. Periodontal disease is an infection of the teeth, gums, and the bone that surrounds the teeth. Most people who have periodontal disease aren't even aware of it. It's rarely painful, especially in the early stages. The main cause of periodontal disease is the accumulation of plaque. Plaque is the sticky film of food and bacteria that forms constantly on your teeth. It's hard to see plaque, but look at how it shows up after we've stained it with red dye. You must remove all of the plaque each day, or it builds up and mineralizes to become tartar, which is also called calculus. The blue spots here are tartar. It takes professional help to remove tartar. There's no way for you to remove it at home. A toothbrush or floss won't even budge it. If it isn't removed, it starts to get onto the root surfaces. Tartar shows up on this X-ray as small white lumps on the sides of the teeth. Bacteria that cause periodontal disease thrive here. Bacteria, like the ones in this slide, produce toxins, and it's these toxins combined with your body's reaction to them that destroys bone around your teeth. Some of the warning signs are persistent bad breath, bleeding of the gums when brushing or flossing, soft, swollen, or tender gums, gums shrinking away from the teeth, loose teeth, and changes in the spaces between your teeth which reflect changes in the underlying bone. A person can also have periodontal disease and experience none of these warning signs. The roots of the teeth extend into the bone of the jaw. When everything is healthy, the bone comes up around the necks of the teeth, and it's even throughout the mouth. A sulcus is the crevice between the tooth and the gums. A healthy sulcus is 2 to 3 millimeters deep. When plaque and tartar invade a sulcus and it becomes deeper than 3 millimeters, we call it a pocket. Once bone has been lost, it never grows back. When too much bone is lost, there's so little support for the teeth, they get loose and have to be removed. Since you may have periodontal disease yet have none of the symptoms, we perform a thorough examination using X-rays and a periodontal probe to measure bone levels around the teeth. When the bone level falls, the gums pull away from the tooth, forming a pocket. We measure the depth of this pocket with a periodontal probe. The measurement is from the bottom of the pocket, where the gum is attached to the tooth, to the top of the gums. These are healthy gums. They're tight against the teeth, and there aren't any pockets. Now notice the difference with early periodontal disease. In general, the deeper the pockets, the greater the spread of periodontal disease. Bleeding is a sign of infection. Healthy gums don't bleed. We also examine the color and shape of the gums. Notice the pink color and the lightly stippled appearance of the healthy gums, like the surface of an orange. In this case of moderate periodontal disease, we see the red and swollen infection of the gums. The stippling disappeared when the gums became swollen. Look especially close at the difference of the gums between the teeth. This is where periodontal disease usually starts. X-rays tell us a lot about periodontal disease. This is a healthy mouth. The bone comes up high around the necks of the teeth, and it's even throughout the mouth. This is advanced periodontal disease. The bone level is much lower. Notice how uneven the bone levels are compared with the healthy mouth. So now you know how we diagnose periodontal disease. Probe readings greater than 3 millimeters, bleeding upon probing, swollen and red gums, especially between the teeth, and bone loss or tartar on the x-rays. A microscope is a new tool to dentistry that really helps in the treatment of periodontal disease. The bacteria that cause periodontal disease thrive below the gum line. To look at the bacteria from a person's mouth, we take a small plaque sample from a pocket and place it on a slide. This is a slide from a healthy mouth. This is a slide from a mouth with active periodontal disease. These are spirochete bacteria, and they're one sign of active periodontal disease. You'll see your own slides when we use the microscope to help you judge the success of your own periodontal treatment. That way, you may be able to see the return to health in your own mouth after root planing. The goal of root planing is to eliminate the source of periodontal infection by removing the plaque, tartar, and bacterial toxins from the root surfaces. Tartar shows up on this x-ray as small white lumps on the sides of the teeth. Routine cleanings remove plaque and calculus from above the gum line. Root planing removes plaque and calculus from below the gum line. To keep you comfortable, we usually numb you before root planing begins. Using instruments like these, we carefully and meticulously plane the root surfaces. Once the source of infection is removed, your gums begin to heal. As they heal, your gums will tighten around your teeth. Home care is the key to keeping this healing going. Since brushing and flossing only go about 3 millimeters below the gum line, something more is needed to clean the deeper pockets of periodontal disease. We'll give you the tools and techniques to do it as part of your treatment. Normally, we spread root planing across several appointments. This way we can check the healing and help you fine-tune your home care efforts. When a tooth is broken down due to decay or fracture, a crown is an excellent way to cover and protect it. In cases like this, when the damage is more severe, there may not be enough remaining tooth structure to adequately support a crown. Years ago, a tooth like this would have to be extracted. But today, by using a procedure called crown lengthening, we can increase the amount of available tooth structure and save the tooth. The first step in this procedure is thoroughly numbing the entire area. Incisions are placed and the gums are gently pulled back. The area is then reshaped and sculpted to the desired shape. The gums are replaced and a couple of stitches are placed to speed healing. After a few weeks of healing, a crown is placed to cover and protect the damaged tooth. Crown lengthening is a minor surgical procedure that is a predictable and effective way to save a tooth that might otherwise be lost. Periodontal flap surgery is necessary when pockets and infection still remain after root planing. After making sure all the areas are completely numb, we gently separate the gums from the tooth. This creates a flap and gives us access to the infected areas. We then remove any plaque and tartar from the root surfaces. The area is reshaped, and the gum line is adjusted to make it easier for you to keep the teeth plaque free. Any soreness after surgery can usually be handled well by mild pain medication. Periodontal flap surgery removes the source of infection, reduces the size of the pockets, makes cleaning easier, and raises your overall level of health. Healthy gums, tight against the necks of the teeth, are an important part of a beautiful smile. But sometimes a problem like this can develop. As the gums extended onto the front surface of the teeth, the natural balance between the length of the teeth and the height of the gums was lost. The first step in a gum reduction procedure is making sure that all of the involved areas are completely numb. We then carefully make a small incision and remove the excess gum tissue. After a couple of weeks, the area will be completely healed. Notice how much more natural this area looks after the procedure. A gum reduction procedure is a safe and predictable way to remove excess gum tissue and improve the natural appearance of a person's smile. When everything is healthy, your gums are snug against the teeth and the root doesn't show. Unfortunately, in some cases we see something more like this. The gums have pulled away from the tooth and some of the root surface is exposed. This apparent lengthening of the teeth can really age a person's smile. If left uncorrected, the loss of protective gum tissue may also mean even more severe problems down the road. Fortunately, a procedure called grafting can correct this problem. The first step in placing a graft is to thoroughly numb the involved areas. Then the graft is taken from the donor site on the palate. In some cases, the incision heals on its own. In other cases, it's closed with a stitch or two. At the site of the graft, we gently separate the gums from the tooth. This creates a flap and gives us access to the area. We then carefully remove any plaque and tartar from the root surfaces. The graft is strategically placed and carefully stitched in place. After healing for a few weeks, the grafted tissue blends in beautifully. The results? The gums have been restored and strengthened, the root surface is covered and protected, and the tooth now has a much more natural and pleasing appearance.